Now back to your experience, Dr. Isam, regarding pharmacists. Since our listeners are pharmacists mainly, many pharmacists face questions from patients related to the cough. They're coming to them with different type of cough. Patients asking what is the best cough product I would take? What do you recommend? I feel that there is a gap, and we call that differential diagnosis. How can pharmacists recognize or differentiate the type of cough, and what would be the best recommendation?
Yeah. Again, doctor, we get back to the organized question. We should classify the cough. First of all, the duration of the cough. Is it acute or long-term cough? The dry cough, wet cough, that's big differentiation between them. Is it the cough on and off or all the time from morning to evening?
Okay.
That's very important.
Or maybe is it a side effect of a medication?
Sometimes,
yeah,
like ICE inhibitors,
yeah.
And the family history of the patient.
Okay.
Smoking, not smoking, obese. He's has this habit to take late dinner, and sleep. All these factors may affect the cough.
Okay, so you mean the cough from the stomach?
Yeah,
that would be
that's one of the.
Because they eat at night a heavy meal.
Yes, so for my advice, the pharmacy can help the patient who has acute cough.
Okay.
Chronic cough, just stop, wait, because we need to do more investigation, especially with some high-risk patients.
Okay.
Like heavy smokers, like a patient with
asthmatic.
Because we need to rule out any a serious issue treated only by cough medication. Cough medication only decrease the severity of the cough, but doesn't treat the disease, because as you know, cough is not a disease. Cough is a symptoms, like the nasal congestion, like fever, it's a symptoms. So we control it a little bit in the acute. So first of all, they need to classify, is it acute or chronic, and need to classify, is it a dry or wet cough.
Okay.
And for a dry or wet cough, we need to ask about other question. A dry cough may happen only because, as Dr. Rawat said, cold and dry air. Cold, dry air may make some hypersensitive to the airway. And again, we get back to this idea that the nose function is to give the lungs the perfect and standard air without any side effect like coughing or even breathing difficulty.
Okay.
So if the nose is not able to do his job for a lot of reasons, maybe because the nose is a blockage for a structural issue, or because the climate
is taking too much decongestant sometimes, as you mentioned before.
Yes. Or the air that he's exposing for a long term is more exhausting to the nose, that the nose cannot give the standardized air to the lungs. Like for example, in Gulf area in the summer season where we live 24 hours in the AC, that may make a long-term cough only because of this cold, dry air. So we ask the patient, what is his occupation? What is his lifestyle?
Yes.
Maybe we help him not with a cough syrup, maybe him with some a humidifier or changing something.
So many patients ask about humidifier.
Yes, because actually I see a lot of patients, even with more than 4 or 5 weeks a dry cough, examination is clear. When he traveled to, for example, to his homeland or to another area for a holiday, cough disappear.
Okay.
So it's a problem with the air that he is inhaling, not because of his immune system or because of an infection or whatever.
Excellent.
So please give the patient the question that can put a fast differential diagnosis for the pharmacy to know what he should do.